Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi everyone, welcome back to this week's episode. I am very excited to talk to you guys about one of my most frequently asked questions in my practice as an aesthetic nurse practitioner, and that is, what can I do for the sagging skin around my eyes? So many people complain I have hooded eyes, my eyelids are heavy, I have excess skin on my eyes. So in this episode, we're going to talk about the causes of hooding eyes, why we have hooded eyes. We're going to do this side-by-side comparison of a youthful eye and a more mature eye. So I'm going to walk you guys through these exact changes with what's happening and why you see what you see. We're also going to talk about treatment options if you do have this and things that we can do at home in order to prevent this from happening. Now, no matter what, it's going to happen, but we can control how much the skin stretches over time. That is something that we can do. So we're going to talk about it in today's episode. Let's get into it. Okay, so let's look at these two photos here. This is a youthful eye. This is a more mature eye. And you can see here with the youthful eye, the skin looks very firm, very tight. You can see the full eye. If you look at the brow bone on the youthful eye, you don't really see any hollowing or protrusion of that bone, versus in the more mature eye, we can see more protrusion of that brow bone. We see more hollowness underneath the bone. We also see excess skin or sagging skin. You can see that skin laxity all around the eye, and the eye doesn't appear as big, it appears smaller. The next thing that you're seeing is something that is referred to as eye bags underneath, and this is in the more mature eye. So what exactly is happening in between these two photos? And here's what's going on. So number one, the skin is stretching. We do not develop excess skin, so you're not making more skin that's falling over time. What's happening is the skin is stretching due to mechanical trauma. And mechanical trauma is something that we do every day to our eyes. I'm guilty of it. You're guilty of it. What is that? So mechanical trauma is when we literally rub our eyes. Think about when you first wake up in the morning and you rub your eyes so you can see. As ladies, we are taking off our makeup, our mascara. We are constantly touching and rubbing our eyes. And this trauma over time is going to lead to more stretching of the skin. And the skin around the eye is already very delicate and very thin. So adding more trauma to the eye by rubbing your eyes, taking off your makeup, all of these things are just going to stretch it out even more. So we're having a skin laxity problem, okay, in this very delicate, soft area. So that's why you're seeing that excess skin. It is not more skin. It's just skin that is stretched out over time, that has lost its tightness, its firmness, and its support. So the next thing that you're going to notice is that hollowing underneath the brow. And you can see in the youthful eye that's just not there. And what's happening with that? Well, as we age, we lose volume, we lose fat, and we lose the structure and support from our bones and our ligaments and our muscles. So our ligaments detach over time, the muscle detaches over time, and things get looser, for lack of better words. You don't have a tight structure to hold the house in. So as you can see in this more mature patient, she's starting to have more prominent orbital bone because you are losing fat and volume underneath. So that bone is protruding out more. And if you look underneath, you see those eye bags, and that's something called a fat herniation. And this happens because those structures that are holding the eye very tight are going to loosen over time. So that fat is going to fall forward or herniate forward. So you just see it more. And that's what's happening. Just like in our face, I'll do another explanation. So A lot of times people come into my office and they're like, I feel tired. I feel hollow. What's happening? And what's happening is that we lose our fat pads, our malar fat, which keeps our face youthful and young. So that fat starts to deflate. We lose that structure and support. And then we have these ligaments that attach to bone, and they are in specific places. When we're young, they're very tight to the bone, so we look lifted and we have fat and cushion in between. And as we age, those ligaments are going to loosen and we are going to lose that support. So you're going to look more hollow. So I can go in with filler and I can go right between those ligaments and mimic that fat to support the ligament and lift the tissue. So that's something that I can do in my office to help with that. Another area that we see this muscle laxity is, let's say, in the neck. If you have, or if you're looking in the mirror or you know somebody that is more mature of age and you see their platysma bands, their bands, and they have like turkey neck, they come into my office and they're like, what can I do for this? And I say, well, there's multiple problems. We have a skin laxity issue, and then we have a muscle laxity issue. So that muscle starts to come off the bone. So if you were to get surgery, the surgeon's going to go in there like in a deep plane facelift, and then you're going to reattach the muscle. So that way they put it back in place so you look more youthful. And then we have to do things to tighten the skin in order to address the skin laxity. So I hope that helps you guys understand exactly what's happening there. So that is the main difference between this youthful eye and this mature eye. Our skin is stretching. We're having skin laxity due to trauma over time and due to the thinness of that skin anyways. We also are having fat herniation or eye bags develop because we're losing that structure and that support. And we're also seeing volume loss. So we're losing fat and that's making our bones protrude more. So we are looking more aged and less youthful. So what can we do? Number one, prevention. Try not to touch your eyes, you guys. I try so hard not to rub my eyes. I used to wear contacts, so it was so difficult. I now got LASIK, and I try very hard not to touch my eyes. I don't try to rub my eyes. I try to use not like makeup wipes, you guys. Stop using makeup wipes, but something very soft and hydrating. I use coconut oil to take off my makeup, and I go very, very softly to make sure that I'm causing the least amount of trauma as possible. If you are using makeup wipes, you need to throw them away because you are causing so much soft mechanical trauma to the eye by wiping off your mascara, and that is going to stretch the skin out over time. So those are things that you can do at home to try to minimize touching your eye, and using very soft products and being so gentle when we remove our makeup. The next thing that we can do at home is we can use some certain eye creams to help prevent skin laxity. So two things that you need. Number one is a growth factor, and growth factors are going to stimulate collagen. So think fine lines, wrinkles, tighter skin, like your Botox in a bottle. There are specific growth factors for under the eye. I love the Zeo growth factor just because of the applicator. So you can use this under your eye. It's also pregnancy safe. So this is very important, and this is going to help stimulate collagen. So this is really your preventative treatment. And the next thing that we need to do is use a retinol underneath your eye. And this is going to help create new, fresh baby skin. So this is something that's very important when we are trying to help prevent skin laxity and volume loss over time. So we need to be using a retinol and a growth factor. And not just any retinol, we have to use a very low percent in our retinol creams, or you will get lots of irritation in your eye. So you cannot use the same retinol on your face and your eye. That is not safe. You need to be using a 0.25% retinol for your eyes. So it's a very, very low amount. That is going to be safe for that skin underneath your eyes, because think about how soft and thin that tissue is. Anything more than 0.25 is going to be extremely irritating. So IMAX by Skin Better is one of my personal favorites. I will link it here for you guys so you can see. But these are going to be your at-home products. Now, what do we do in office when we have sagging skin? So some of you might be like, oh my gosh, I already have sagging skin. What can I do? So I'm going to start from most invasive best option to least invasive best option. First thing is a surgical blepharoplasty, and a surgical blepharoplasty is a plastic surgery procedure in which the surgeon is going to cut off the excess skin and then they are going to reattach the skin to your bone, and you are going to look like you don't have any excess skin. Your eye is going to look very tight. It's literally surgically taking off the stretched out excess skin and putting back your skin where it needs to go. So this is number one. You can do an upper bleph and a lower bleph. And a lower bleph is going to help that fat herniation. So if you have that eye bag that you can see in this mature patient, if you were to do the same thing, they're going to cut off the skin, they're going to take out that fat that's fallen forward, and they are going to reattach the skin. This is going to be the best option. It is a one-time procedure. It's going to run around $5,500, maybe a little less, maybe a little more, but this is number one. So I always tell my patients, if you want best possible results, you need surgery. Go get your surgery and then come back and see me. Number two is we can do things to tighten the skin, and this is going to be non-surgical. This can be done in conjunction with surgery, which I always recommend. You're going to get the best possible results like this. And what I really love to do for excess skin around the eye is CO2 laser. CO2 laser is going to ablate the skin. So it's going to take off that first layer of the skin, and you will get amazing outcomes, you guys, with skin laxity. So you can actually treat the entire eye. You can treat below the eye, above the eye, even on the eyelid. Now, the key to doing this treatment is you need to go to an expert provider that understands depths and tissue. It is not safe to get this treatment without an eye shield in your eye because you can have damage to the cornea. So you need to be going to somebody that understands this, that is practicing safe medicine. We do this in my office and it is a game changer. You will see tightening of the skin. It's actually very preventative as well. So I do this treatment twice a year just to try to help prevent skin laxity, because you're going to get that mild tightening effect. Just doing one treatment every 6 months is going to be huge. Now, if you have sagging skin and you're trying to treat that sagging skin, you're going to need to do a series of 3, and then you will need to do maintenance. So you'll just need to do more treatments to get the best possible outcome. And I always tell my patients, I can guarantee around 50 to 80% correction, depending how severe your skin laxity is, with those non-surgical options. So that's pretty much my go-to when it comes to treating excess skin around the eye. Now, something else that I really love for underneath the eyes is PRF, or exosomes. And I love these treatments because it's growth factors that are injected underneath. So they're going to be injected underneath the eye. And what it's going to do is it's going to help thicken your skin. We know that the skin underneath the eye and on the eye is very thin. So anything we can do to thicken the skin is going to help. So I will recommend the CO2 laser in addition to these in order to thicken the skin and get the best long-term results. You can also do this for prevention. So it's something that I highly recommend. I do it for my own eyes every single year. I'm doing everything I can to prevent skin laxity, even though I know it's coming and I will end up getting surgery eventually. I try to do everything to maintain my skin as tight as possible. So another option that we talked about skin laxity, tightening the skin. Now, something that we can do with the muscle, and I'm going to show you guys a video of me actually doing this, is injecting the pretarsal. And this is a muscle right on the eyelid, and it is responsible for opening up your eyelid. I promise you guys, it looks a lot scarier than it actually is. This injection is a game changer. I am going to place 1 to 2 units strategically in the pretarsal muscle. This is going to help open up your eye. So I tell my patients, this will give you like a 20% correction. It is amazing. This is a before and after, so you guys can see what this looks like, but look how much open her eyes are. They look absolutely amazing. Now, it's not just getting that unit on your lid. I'm also injecting all around the eye for brow lifting. So I'm doing a total of around 15 to 17 units per eye. So just to give you perspective of what that's going to take, and you're going to do this every 3 to 4 months. So if you are doing the pretarsal injection with a CO2 laser, plus using your creams at home, you are going to get amazing outcomes. Not as good as surgery, but it will still look really, really great. And if you are wanting to do preventative measures, I recommend doing all 3 of these things in order to prevent muscle laxity to prevent skin laxity and to thicken up that skin in that area. So hopefully this helps. Make sure you guys see an expert provider. This is something that has to be done by a board certified nurse practitioner, by somebody with a medical license, like a physician's assistant, a registered nurse working underneath a medical director, or a doctor. So important, you guys, to go to someone with experience in treating this area. It is a high risk area, so I cannot stress this enough, but hopefully this helps give you guys some perspective on things you can do at home, preventative treatments, in-office treatments, and ultimately what is happening with why you are seeing these changes in the skin, why you notice hooded eyes with time. Thanks for tuning in.